The gentlelady yields back. The gentleman from Pennsylvania, Mr. Keller, is now recognized for his questions.
Thank you, Madam Chair. Thank you, Ranking Member Comer, and thank you to the witnesses for being here today. Socialized medicine is not only the wrong approach, it would be detrimental to our healthcare system and the patients who rely on it. Americans are the ones who are best equipped to make healthcare decisions for themselves as well as for their families, not the government. I want to talk a little bit about a personal experience, but before I do that, two names, Alfie Evans and Charlie Gard, a toddler and an infant in the UK, whose doctors said they would not survive. So the doctors took the parents to court and were forced to remove their children from life support. One child could have gone to Italy, and one could have come to the United States for care, but their government didn't allow them to do it. Now I want to talk about 1994, when my son had a brain injury, and he was life-flighted to Geisinger Medical Center, and they performed brain surgery, and he came out of the surgery, and the doctors told us, they said, kids in his condition aren't a 50% mortality rate. It's not 98% mortality rate, it's 100% mortality rate. And over the coming weeks, we were told to remove him from life support because he was not going to survive. But we had control of our healthcare decisions, not the government. And because of that, the following year, it says Freddie Keller of Kramer is Geisinger's poster child for 1995 in northeastern and central Pennsylvania. He's now 31 years old and works for the healthcare industry in supply chain because we had choices over his care, not the government. So that's socialized medicine. That is universal health care. That's someone, a bureaucrat from the government, deciding what's best for you and your family, not you. And that should never happen in the United States of America. Never. So I did want to just ask a question to Ms. Turner. Might these policies affect patient wait times for treatment, and which patients would suffer most from the increased wait times?
Very powerful story, Congressman. Thank you for sharing that. We do have evidence of what happens when systems operate under a global budget in other countries. And as you say, you wind up with government making decisions about whose life matters. And they do that in sometimes very subtle ways, something called quality adjusted life year, where they decide whether or not your life is worth getting a new medication that may be on the market. So I think the choice and control issue is profoundly important because it also focuses system on the patient rather than on bureaucrats making decisions about people's lives.
Just another question. In addition to restricting choices and access to care, would a single-payer public health option truly lower health costs for Americans?
My colleague, Merrill Matthews from the Institute for Policy Innovation, actually looked at the administrative cost savings. And when he made an apples-to-apples comparison, he said it's not going to save any money administratively because the government's still going to have to make sure that a procedure was provided. The documentation will have to be there. The person will still have to be paid. There will still have to be all of the paperwork that we have now. It just runs through a different system. So it is not clear to me to see how it would save. And Chuck Blauhaus from Mercatus Center says that it would actually cost $32 trillion over 10 years.
Okay, thank you. This is something that I always say. Changing who pays the bill does not make something affordable. All it does is remove choices from people. Not only would socialized medicine offer patients fewer medical options, limit the number of qualified medical personnel in the midst of a healthcare worker shortage, and discourage medical innovation, proposals like Medicare for All would cost the taxpayers an estimated $32 trillion over 10 years. The cost of government-mandated universal health coverage is simply too huge. And I tell you what, the cost of my son's life under a system like that had to be endured by the parents of Charlie Gard and Alfie Evans. I don't want to see that happen to any family in America. The government should not be telling you whether or not your child can receive life-saving medical attention. And thankfully, here in the United States of America, I didn't have to face that choice in 1994 when I was 28 years old, struggling to make ends meet. And my son is still alive today. Thank you, and I yield back.